There are some important causes of blindness, and if we look at the global data, the important causes are cataract, uncorrected refractive error, glaucoma, age-related macular degeneration, diabetic retinopathy, and corneal opacity. So, corneal opacity is one of the very important causes of blindness. The second fact that we all have to keep in mind is that the distribution of these causes is region based. In some countries and some regions of the world, corneal opacity is an important cause, and India is one of that country where corneal opacity constitute an important cause of blindness. The second important fact that we have to keep in mind is that the diseases that result in loss of transparency of cornea are such that the chances of success of corneal transplantation for these diseases are lower than what are the causes in the Western world. For example, in United States, the important causes are keratoconus and corneal endothelial dystrophy, whereas in our country, the most important indication for corneal transplant are vascularized corneal scar, the corneal infections, and then the third important indication is failed graft. Now, why this is important to know? Because the chances of success of corneal transplant procedure for these indications are less. Close to about 50% of the graft performed for these procedure fail over 5-year period. Now, how that has an impact on eye banking? It is very obvious that in countries where corneal blindness is more important cause or the burden of corneal blindness is high, and then the chances of success of the surgery are low, eye banking will not only have to provide tissues for primary grafts, but also will have to provide corneas for those where first graft fails. So, in essence, for our country, we need to collect close to about 200,000 corneas every year. And this data is based on the assumption that close to about 50% of these corneas may not be suitable for transplantation. That is, every year in our country, we must perform close to about 100,000 corneal grafts. But the situation is very, very different. Despite having close to about 300 eye banks, we collect somewhere around 65,000 corneas each year, of which close to half of the corneas are only found to be suitable for transplantation. So we are doing only one third of what we should have been doing to take care of corneal blindness. The situation is very different in United States. In 2019, they almost collected 130,000 corneas and there are only 80 eye banks. Now, what does this indicate to us? It very clearly indicates that our eye banks need to become more efficient if they have to continue to provide corneas for corneal transplantation. In addition, we also need to train more corneal surgeons who then can perform these procedures. The third big challenge that we have is that we are not following any kind of a eye banking network. Our chairman, Dr. Gullapalli Nageshwar Rao, proposed in 1990 a three-tier model of iBanking where there are 5 or 6 iBank training centers which are linked to iBanks, and then each iBank is then subsequently linking to iDonation Center. LV Prasad Eye Institute, we are emulating that model. We currently have Ramayama International Eye Bank as the center of excellence in eye banking, which is linked to 4 other eye banks. And now we are expanding along with the Hans Foundation, other iBank, which will be joining this network. Each of the iBank has a number of eye donation center. The function of iBank is to also not only collect corneas but also process cornea. In last year, because of this network, we were able to collect 100,000 corneas total since inception. And the last year, that is 2019, tally was 10,000 corneas. The other issue that we need to pay attention to is quality. All the eye banks should be managed by trained staff must maintain medical standards of eye banking, and we should slowly get into the process of certification of technicians as well as accreditation of eye banking. We can learn a lesson from Sri Lanka Eye Bank. The Eye Bank was initiated in 1958, and by 1967, Sri Lanka became self sufficient as far as availability of cornea is concerned. And in the year 2018, they collected 48,000 corneas, which were utilized over 25 different countries. What it means that they were able to export corneas to other countries and help them eradicate corneal blindness. Now, what was the success of that model? The success was that the various members from society started joining this movement. First, the head priest of Buddhist monk, made an appeal to the countrymen that this is a noble cause and they should start donating corneas. Subsequently, the Prime Minister of Sri Lanka also made an appeal and himself promoted eye donation. I think Kamba is doing a wonderful job of spreading the message of eye donation. And if we can, in some way, engage honorable ministers, including prime ministers and Sar Sanchalak of RSS, I am sure this movement will become much, much successful. With these words, I like to conclude my talk and will like to thank Saksham for inviting me to this wonderful evening. Thank you very much.